Hi, Dr. Tracy Wilson. Welcome back to the Collaborative Cancer Care YouTube platform. How are you today?
I am wonderful, Dr. Wendy. It's great to be back with you again.
Yeah, I am excited to talk about this article you co authored. I am excited to share it with our audience as well as everyone on our email list, on our platform. So, you co authored an article titled Identifying and Addressing the Needs of Caregivers for Patients with Cancer, Evidence on Interventions, and the Role of Patient Advocacy Groups. So, I want to know, where did this article come from? Why did you want to be a part of it?
So this was a joint effort with a team of us from work. I got a chance, I got tapped because of a video that I did talking about my husband's journey and me being a caregiver. So a little backstory again, and going along with the video and the conversation that we had previously on talking about my husband's journey with having multiple myeloma. So my husband being diagnosed with multiple myeloma back in 2017. And so just talking about, his journey and then me being a caregiver, and just talking about our experience, this was discussed at work, and it went to all of the global colleagues there. And so once they all saw that, they ended up doing an article in regards to it. And then the cancer team ended up reaching out to me and tapped me and asked if I would want to do an article with some of the team members there, and talk about being a care, because they were looking at the caregiver experience. And I talked so much about how patient advocacy groups and how the patient advocacy team was such an integral part of our experience. And so they wanted to know that, would I want to be a part of the co authoring team? And I said, absolutely, because I knew that how it was helpful to us, and how I knew for us, if the information that I felt sometimes, that we didn't always get, but then in the end, how it did make a difference, I knew that there was other people that felt the same way, like we did. And so it included another teammate that his father had colon cancer. He was a part of the team, and then it also included other individuals from patient advocacy groups as well too.
Oh, that is amazing. Where can we find the video that your employer saw that made them tap you for this article?
Um, I don't know if it's available for external
Oh, okay.
viewing. Uh,
Okay.
yeah,
Okay.
so I think this one, and because other people have asked me in regards to that particular video, but I think I have the article.
Okay.
In that article, I can share in regards.
Okay. Perfect. Perfect. Well, in this article, you and your co-authors identify really four pillars or four areas that are unmet for caregivers. Can you talk a little bit about those pillars or areas, and how did you guys come to terms with picking those four? So it
Um,
was information, relationship, communication, emotional, practical, and financial. Um,
so Yeah, so thank you. So I think for those particular areas, I think, we saw that those were actually, key areas that for, us, you know what I mean, as caregivers, those are usually areas that are big struggles. It's the information, the lack of information, that you sometimes when you're going through, any particular, what I mean, disease, in particular with cancer, you just don't feel like, where's the information? I'm not getting enough information. Where do I get this information, from? Um, I know for, me as a caregiver, not only for my husband with multiple myeloma, but my mom who had colon cancer, for her, where do we get good, credible,
Hmm.
understandable information? Where do we get this information from? And so, whether that's from the clinician, or from, again, these patient advocacy groups, where else can we get this information from? So, information. Then also, relationship and communication. So having, a good relationship and good communication from the clinician itself, that was something that we wanted to ensure that as the caregiver, you're going to be spending probably, at least half the time with the clinician, as also the patient as well too. So you need to be having a good rapport with that clinician as well too. So I think that's something that's can be not always discussed,
Hmm.
but that needs to be built.
Yeah, I was reading somewhere that patients and caregivers value relationship over like knowledge. Like they were saying that patients prefer a clinician who they are close to, they can talk to, they feel that rapport with, and they prefer them to say, "Well, I don't know, let's find out together," versus a provider who thinks they know everything and they don't have a great rapport. So that really speaks to that point of how important relationships are.
I mean, speaking, I think both of us, being clinicians ourselves, I think I value that and try to ensure that my patients, feel comfortable with
Absolutely.
me, that they are leaving the room, feeling valued, heard, seen, and understood. Because on the flip side, being a patient, being a caregiver, that's going to be the number one thing, that I'm wanting and seeking, from my clinician as well too.
Yeah,
Um,
absolutely. Absolutely.
the other area being, the emotional side, and making sure that, that mental health side of, being a caregiver, and then also for the patient. So making sure that you're seeking, therapy, going to talk to someone, or that you're doing that self care, portion. Whether you're doing meditation or yoga or whatever that looks like, that you're
Mhm.
taking care of that emotional side, so that you're reducing as much of that stress, as possible. And then lastly, the practical and financial, stress, that this is a very costly illness.
Absolutely.
And so that we are helping them to look at, the cost, of the illness, that we're connecting to, as many resources. And that's where these patient advocacy groups really, really can help with, whether that's copay assistance, whether they're, the discount, cards, whatever that can be. That's where they can really, come in handy. Even, I know for us, in working with, LLS, Leukemia and Lymphoma Society, that's, even helping with, getting to, the actual doctor if you're needing that. They can help with, taxi vouchers, things
Mhm.
like that as well too. So that financial, component, because these drugs are costly.
Yeah. And something I'm hearing, and as an oncology professional myself or a clinician myself, um, collaborative cancer care, I think we fill all of those unmet needs because we not only
Mhm.
do the mental health. We definitely build the rapport. We communicate. We help our patients advocate for financial assistance or anything else they need. But what I'm hearing in the field where clinicians are taking care of cancer patients, whether it's in a hospital, an oncology clinic, infusion center, is that it's not that they don't want to provide the resources. They just don't know where the resources are. Like, everyone knows that anyone going through cancer needs some sort of financial assistance, right?
Mhm,
Majority of people.
mhm.
Everyone knows that if someone is diagnosed with cancer, the patient and the caregiver are going to go through some emotional or mental distress,
Yeah.
right? Everyone knows that information is needed. This is new language. This is a whole new lane, right? Even as healthcare professionals, we want to be treated as the patient. We want to be treated as a caregiver. You need that information. And everyone knows that when you are your sickest or there's uncertainty, you want to know that you have a good relationship with that person so you can build trust,
Yeah,
right?
absolutely.
So it's kind of like, I feel like they want to do it, but where are the resources? Like, where do they go? I have a patient coming in. Where do I go to provide them this thing? You know what I mean?
Exactly, exactly, exactly. And I think it's so much information, but yet it's almost like a seek and find.
Yes.
So
Yeah.
where to find that information? And that was one of the things that I kind of wrote down that I wanted to kind of make sure that I mean I said me during our conversation today is that me clinicians we as clinicians can do a better job of asking about the whole family. I mean, especially the caregivers to ensure that, I mean, they are getting the resources that they need. Because I think sometimes when we are in these conversations or when we're taking care of the patient, sometimes the caregiver is left out
Oh yeah.
of these conversations.
Yeah.
And so that was one of the reasons why this bubbled up and came to fruition is because the caregiver is that forgotten person. And
Yes.
so clinicians have to be a little bit more cognizant that while they're taking care of the number one priority, who is the patient, that caregiver, one question, how are you doing? What additional resources, can we ensure that are being provided for you as well too?
Yeah, absolutely. And just like I know, because we're both doctor prepared nurses, we learn that, the patient is the family. It's not just the person who has the diagnosis or who's sitting on your table. Because usually when you do that type of assessment, when you look at a patient holistically, you're able to see different things that can impact them, right? Or the family, but the family becomes your priority. So I think you are so right. And it makes me think about in my other line of work that I do is stress in healthcare professionals. So that's why it's so important what you're talking about. They have the capacity to even do that, to show the empathy or compassion to the patient or the caregiver, right? It's like, so it's so much to unpack there, but so needed because the caregivers usually are silent, even though they are going through a lot.
Mhm, mhm, mhm. And there was one of the things that we talked about in the article and about the percentage, and it said that 29% of caregivers discuss their own self-care needs with healthcare providers.
Hmm.
So, I mean, only a small fraction of us only discuss our own needs. And so that's why it's so important that that information is pulled out because caregivers won't, unless it's asked,
Yeah,
we won't discuss it.
right,
And I'm speaking from my own personal experience. I won't say anything.
right, right.
I'm
You almost
busy.
feel
I'm a
guilty.
busy.
Yeah, but you also almost feel guilty because, like, this is not my visit. This is for my loved one. I'm just here to support. right? Not knowing you need support as well. But one other thing that I see in healthcare, and I mentioned this before, I mention this all the time, is that we do have advocacy groups. We have advocacy groups that are doing great things that have the resources, but there's a disconnect between the advocacy group and the clinic or the hospital or the place where the patient and the caregiver is being treated, right? So it's kind of like, I feel like institutions or organizations need to be dialed in. They need some sort of like liaison where
Mhm.
they kind of know what advocacy groups are in the area, what do they offer? Because what I said before, oh, they just don't know. Who's feeding them that information? There's such a disconnect. I feel like advocacy groups are more so in the community,
Correct.
but what's going on in the hospital, there's no connection there or very little connection.
I agree. I agree, and I think there can be, like you said, the liaison, or we have those, the nurse navigators, social workers, those individuals that are usually more keenly aware of those resources that are in the community, and I think if we had better communication with those individuals, with the clinicians, to the patients, I think more awareness can be brought about these resources, because they are abundant
Mhm, mhm.
and ready to provide as many of these resources to these patients. So I think at this particular point, it's more just awareness, um, and bridging the gap between the clinician and the patient.
Yeah, no, absolutely. And out of those four areas of unmet needs for caregivers, if there's a caregiver listening right now, what is one thing they can do, right? Because we say four, that can be overwhelming, but what is one thing? What's the highest priority, you think? If I can do one thing to help a caregiver?
Oh gosh, if there's one thing, I would say maybe the communication. It's it's tough between communication and the information.
Hmm.
Um, because I think if you have the rapport, if you trust the clinician, then you know what to ask.
Right, right. Yeah, yeah. No, that's good. That's good. Is really trying to build the rapport so you can communicate with the caregiver. Yes.
Mhm, mhm,
And even like from my clinical practice, when I was a infusion nurse or even an NP, working in a traditional healthcare system with cancer patients, we had that rapport. We had the rapport with the patient, with the family member who would bring them in. However, there was nothing in our system, right, of how we, assess the patient, document on the patient. There was nothing in the EHR or note pertaining to the caregiver. So maybe building it in there where it becomes part of the visit. Like,
mhm,
who are they with? And
mhm,
maybe a scale, maybe the distress thermometer scale, or just something, right? To maybe
mhm.
use what can start the conversation. So maybe we need to figure out how we can incorporate, because once it's metrics and once someone's looking at it, people are apt to do it, right?
Absolutely, absolutely. Just a part of the conversation. Again, and again, it doesn't even have to be, very long. If it's just, I mean, one or two questions, just addressing the caregiver
Right.
that's there, then at least it opens the door, just to check in on them, and how is their mental health,
Mm,
and if there's any additional resources, because if there's a question in there about resources, then that puts the onus on the clinician or that healthcare provider to at least look up what resources, or patient advocacy groups that are available, and make them, be knowledgeable about what's available in the community.
Yeah, yeah, absolutely. And I think, that that's definitely a gap that maybe we need to be talking to some EHR companies about, or some, oncology regulation bodies. Like, we need a question. Can we start with a question that,
Mhm.
centers are measured by? But yeah, no, this was a great article. I think everyone needs to read. And I love that you have the plain language summary in there. I did catch that. I
Mhm.
got that.
Mhm. Mhm.
Can
Mhm.
you tell us about that plain language summary and why you guys put it in there?
I mean, I think again, I mean, in regards to making sure that, it's understandable, because again, when we're talking about health literacy, everything needs to be understood at, sixth grade, what I mean, language, because that's how any literacy or tool or informational resource should be given, to any patient. So that's why we wanted to have a resource,
Yeah,
that's available to, a patient. So yes,
yeah,
we wanted to ensure that when we're going to be talking about any kind of literature or health resource, make it plain language, understandable, to any patient, that is going to be receiving any kind of, tool.
yeah, awesome. And before we wrap up, I have one more question.
Mhm.
So, if we have a caregiver who may be listening to this, how can they utilize this article to really advocate for themselves?
I think as a clinician or a healthcare provider, when you're looking at this particular tool, I mean, you can look at it to say, like, how can I, look at how can I improve my knowledge base with patient advocacy groups? How can I improve my knowledge as far as resources and tools for the patients that I'm caring for, that are dealing, one, with cancer, and then also with caregivers? So how can I improve my knowledge in this particular arena or in this particular space?
Yeah,
When we're dealing with caregivers, and then also patients that are dealing with cancer, and then being a better advocate for patient advocacy groups.
yes. And what about like the cancer caregiver? Would you suggest they take this article with them to their next appointment and
I,
share it with their healthcare professional?
I would, because it can help them build, again, build their questions.
Yep.
It can help them have a better understanding, because we talked about different types of cancer. So it's not just one, it's also multiple different, cancers. So then they can also highlight, well, clinician, what do you know about this particular, patient advocacy group? Can you get me connected with them? Um, and then also it arms them, the patient and the caregiver. It can arm them a little bit more as far as being, a caregiver. What they need to know, as far as how can I be a better advocate for my loved one that is going through this. So when I'm in this healthcare arena, I know what I can do to get them the, I guess, better care, more care, enhanced care,
Right.
when they're in, while they're in this situation.
Yeah, awesome. Well, Dr. Tracy, this was great. I love the article. We're using it here in the clinic. All the clinicians have a copy, and yeah, it's great. We're not going to let it die, right? We got to keep it up, and it's big now, but we got to keep it going, make it sustainable, so we can really bring about change to really support cancer caregivers. So, thank you so much for the article, and we'll have to have you back again.
No, my pleasure. Thank you. Again, it's all about just ensuring that caregivers are empowered to care for, advocate for their loved ones in all of these spaces. So thank you.
Awesome.